Hello, my dear students. Welcome to our today's new campaign on endodontics. It's a easy topic because every day in our private clinic we go with RCT, which is a endodontic treatment. Now, in interview, the first question which they might ask you will be, what is the other name for root canal treatment? At this point of time, you will not be confused. You should be able to answer that what is the other name. So please mark your presence and comment. You can also comment in the comment box. What is the other name for root canal treatment? Let all the students mark their present first. It's a short introduction. In today's lecture, we'll be discussing many things which will be possible, and if it is not possible in today's lecture, we'll be continuing. In short, you will be knowing each and every basic point which are being asked in MCQs. Recently, many exams have been conducted for conservative as well as endo. So from those questions, we have prepared certain topics which are very important and without which uh, you should not go to attempt any exam. We will wait for all the students to join. Afterwards, we will start today's lecture. On the screen, you can see we are having the paper of assistant professor, which is being conducted before 2 months or 28 January. Now there will be question on your mind. What is the type of paper? We will first of all, before teaching you endodontics, we will just go with the paper pattern. Understand the paper pattern. Please mark your presence. Afterwards, we can start today's lecture. In today's lecture, we will be just giving you an introductory section of these MCQs of 5 minutes. Then we will start today's topic. You can see the first question. Which of the following premolars has a mesial marginal ridge more cervical than the distal marginal ridge? Okay, so I think this is not a conservative endodontics question, but it is DADH, dental anatomy, dental histology. So why people are asking this? Because overall you are a dentist, which is uh, telling you by itself that you should know everything about the tooth. So they can ask this question. Apart from DADH, why this question is important for endocons? Because while tooth preparation, you should know the anatomy. What are its ridges? What are line angles, point angles? Everything you should know. So I am making it easier for you that whenever you are preparing, you just think that any questions can be asked related to conservative, related to endodontics, or related to any subject in dentistry. Okay. Now, second question: which of the following permanent teeth are most difficult to distinguish between mesial and distal aspects. Okay, so same, it is a DADH question as well as anatomy. Now they are already giving you syllabus in your exam pattern. They will ask you that anatomy will be asked, physiology will be asked. So this is the anatomy related to conservative dentistry. Okay, here the answer will be mandibular central incisor. Most common morphological variation, it will be lateral incisor. What is Rubinstein-Tiabi syndrome? Can anyone explain? On which tooth we can find this? These are the most common repeatedly asked questions. Eagle syndrome. Please comment if you know about Robinson-Tiabi. Such OP related syndromes, questions, or something special regarding a tooth or gingiva, absent bar nodules, all these topics which are very important will be asked in your MCQ exam, because these people have a pattern of asking you 100 easy questions out of 200, then 50 will be medium and 50 will be tough, in which will be very difficult for you to answer that. So these are the easy questions which I am asking you right now. What about syndrome? What about this eagle syndrome? Here the answer will be lateral incisor. Robinson-Tiabi syndrome is associated with lateral incisor. Okay, so now we will start our endodontics lecture. I wanted to show you that merely endodontics or conservative, this topic questions will not be asked. It is not limited only in tutor exam. Many people who are preparing for tutor, they will think that I will clear all my conservative endodontic subject and then appear for the exam, but they will fail, because your paper will be prepared in such manner that questions can be from any of the dental subject. Okay, till now if you're having any doubts regarding exam syllabus, exam pattern, you can tell us. This is the previous year paper or previous dental GPSC paper of Consendo. So many questions may be repeated in your dental surgeon class 2 exam, class 1 exam, tutor exam. So all these are available in our website, AI medical dental academy.com. Okay, so these are all anatomy questions. So prepare your basic subjects thoroughly, also with clinical subjects. Till now, if you are having any doubts, please WhatsApp. So now we move to our today's lecture, what we are being planning and what you are going to attend. Endodontics. It is mainly related to, in short, it's a sort of RCT, because we nowadays have changed the term root canal treatment. We will be discussing pulp anatomy first because most of the questions will be asked regarding its blood supply, nerve supply, okay, its development of the pulp, connective tissue contents, etc. Then we'll be discussing endodontic microbiology, the main reason for endodontic problems. Okay, what is the etiology or what are the organisms which are causative for this problem? Then diagnosis and treatment planning. It is not just mere that TOP is present and it is a problem in the pulp. Many times your diagnosis and treatment planning plays an important role. Pulp sensibility test. So you can go with various tests, whether it is pulp is vital, not vital. Pulp diagnosis, various tests are there for that. Periapical diagnosis. In this, we can go for radiographic help also, as well as symptoms from the patient. Decision tree for pulpal diagnosis. What are these decision tree? Sequel, complications. Decision tree for periapical diagnosis. Both these things we have discussed in oral pathology, and we have been taught you this oral pathology third year BDS. Pulp therapies. What are the various therapies you can go? First of all, you can apply sealers. Also, we have varnishes, then bases, its properties, its function, application, liners also, its importance, properties, functions, applications, purpose. Many times when we were studying, we just thought of these things that you have to mug up something because what are the liners? They just prevent chemical entry or chemical they provide chemical barrier, whereas cavity bases they provide chemical as well as mechanical as well as thermal, all chemical, mechanical and thermal barrier. And cavity sealers they just prevent the debris or minor particles to enter. So in this way you have to prepare the classification because in interview you might be asked what is the difference between sealer, base and liner. Okay, so what you will prepare, you can go with tabular form. Okay, its main rule. Then which are the examples or which are the agent used, some specific protocol or timing, which are the advancements. In this way you have to clear all these three doubts. Same way here also pulp capping, pulpotomy and pulpotomy. Its definition, then indication, then contraindication, its advantage, disadvantage, procedure and clinical applications. All these points you should know. Now why I am asking you to write all these main points? Because when you answer an interview, you have to go systematically. I am teaching you both theory as well as interview. Because after passing theory exams, you will be having lack of confidence in interview. So you should not be in a that manner that what should I answer, how should I answer. Okay, you should be able to present that topic or present your answer in a systemic manner. Okay, endodontic radiography. We will also discuss our radiographic features which will be related to endodontics, or what are the specific things we can find in radiographic. For example, Bull's law. Sorry, Bull's not. Slope rule. Bull's law is related to perio. Slope rule. Okay. Same lingual opposite buccal. This is for root canals. Distinguishing between mesial and distal root canal. Now you can also be asked in interview, what is the significance of radiograph in endodontics? So you must mention this slope rule. Many other applications are also there. Mere slope rule is not the answer, but this point is to be answered in your interview. It should not be forgotten. Endodontic instruments. Nowadays, they have a pattern of asking image-based question. So they might start from this GPSC. It might be your paper with color, and image-based questions might be there. Here we are having hand instruments as well as night eye instruments. Now the whole advancements